This is Shareef Mahdavi, and this talk is on Sex Lies and Videotape Lessons for Cataract Surgeons in 2011. First presented at the Hawaii meeting in January, and this encore presentation will use the Pachachka style of presenting, where you do 20 slides in 20 seconds apiece for a total 6 minutes and 40 seconds starting now. I do want to disclose that I don't currently have any consulting relationships with any of the femtosecond laser manufacturers involved in cataract surgery. I do work with a number of the ophthalmic manufacturers as a consultant, and most importantly, I am an optimist when I see the future of cataract and refractive surgery, meaning the glass is more than half full. There's been so much buzz about what's happening in the world of cataract surgery and the potential use of a laser. This buzz and the discussions I've been having and hearing with surgeons borders on infatuation. When I hear cataract surgery being thought of as hot and sexy, it even brings images of lust into the picture. Well, is this excitement warranted? Let's kind of look back. If we notice that, cataract surgery with 3.3 million done in the US is the top surgical procedure. There are 800,000 LASIK procedures being done in the US, making it the top elective procedure. And when you think about marrying a cataract and laser, well, our minds and imaginations can go wild. But first, let's look at some lies, and the first lie that I want to look at is that patients won't pay or pay more for cataract surgery. We really have to ask ourselves whether this is true, and I've done several studies over the years looking at consumer willingness to pay for elective procedures. First one we want to look at is in LASIK itself. And when I looked at the impact of intralays over the years in its early launch, you see that patients are more than willing to pay out of pocket for a procedure that they deemed as safer and better. When we also look at willingness to pay in cataract surgery, we see that patients are willing to pay out of pocket for a premium result. The second lie is that patients don't want this. And I would have to turn to looking at the difference between a patient today and a patient in 1960. You see that they are very different looking individuals. In fact, the woman on the left is authoring a book, Sexy in Your 60s. So clearly times have changed when we think about someone who's 60 or 65, and in fact their retirement age, when someone retires, the amount of time they're going to be living now is 10 to 20 years, not just a few years, making an investment in your vision something that's going to be worthwhile and have a much greater return and allow people to enjoy life much longer in their later years. In fact, people are paying a lot of money for elective procedures, and here are some that are outside of the world of ophthalmology, but you see people paying thousands of dollars to look better, feel better, sleep better, smile better, and in fact to be seen better in the case of the hair transplant. The first boomers have now turned 65 and have entered the Medicare system, and they're going to turn at the rate of 8,000 to 12,000 a day every day for the next 15 to 20 years. And it's important that we understand that this generation of baby boomers, many of you listening are in fact baby boomers, acts and behaves very different from preceding generations. In fact, this is the generation that grew up listening to The Who, whose song My Generation and whose anthem Hope I Die Before I Get Old is absolutely true. And if you think about people who grew up listening to The Who, and you think about them now having cataract surgery, that begins to plant the seed about a very different set of expectations that they have. The third lie, which really comes down to our readiness as practices to take full advantage of this technology, comes on top of regulatory issues, availability of the technology, and the business model about how surgeons are going to pay and make this business work in their practice. But let's first look at things like first impressions and who's answering the telephone. I've got years and years of data, much like the videotape that coaches review after football games, and can tell you that when it comes to the first impression we're making, we are woefully inadequate in terms of being more like Donna Reed and less like Nurse Ratched. And when it comes to preserving value for our procedures, we seem to be confused in terms of raising fees, lowering fees, thinking lowering fees are going to raise demand. And you see here in LASIK over a 12-year period that when we lowered fees, actually demand dropped as well. And when fees came back up due to intralays and due to custom, procedure volume went up as well. Contrast that with what plastic surgeons are doing, and you see that they've done a good job historically of preserving value for their top elective procedure, which is breast augmentation. Procedure fees went up 30%, volume tripled over that same period where you saw the up and down nature of laser vision correction via LASIK. And it's important to understand that we never want to diagnose someone's pocketbook. People's ability to pay has more to do than what amount of money they have in their bank account. And using Care Credit is a method to help you preserve value for this technology that many of you are about to get engaged in here with the femtosecond laser for cataract surgery. If you think someone's going to want to pay money when they enter an environment that looks like this, I think you're wrong. Would you want to pay money here, or would you want to pay it in this, a pediatric dentist's office, an audiologist's office, or a LASIK spa combination? These are all much, much nicer environments when we're thinking about people spending money. Because at the end of the day, the truth is that nobody wakes up in the morning saying, I want eye surgery. In reality, people do buy what they value, and they're more than willing to pay for it. And finally, everybody wants to feel special. And with that, I say thank you for listening as I go to my final slide. And if you'd like more, feel free to visit my website, send me an email, join the Premium Experience Network where you'll get access to my blog, or follow me on Twitter at Shareef Mahdavi. Thanks so much. Make it a great day, and please take this to heart as you're considering entering the world of femtosecond laser cataract surgery.